Hi, welcome to my channel Dentistry with Kashaf. You might have heard about the condition called as target lesion. Yes, you heard that right. I said target lesion. If you are not, then let me show you. It might look like this on your skin. In a condition called as erythema multiforme. Yes, you heard that right, erythema multiforme. Erythema multiforme is an acute immune-mediated skin condition which is characterized by the distinctive target or bullseye lesion on the skin. It usually appears on the hands and feet, arms and legs, face, and oral mucosa. It might be symmetrical on both sides of the body. It will be itchy, painful, and asymptomatic for some time. The target lesions having three zones. The outer one is a redder zone. We can say red outer ring. The middle is a pale ring around the center, and the middle in the innermost is a dark or blister center. You can clearly appreciate in this picture. Then, what actually triggers this immune condition? We know that certain infections, like any bacterial or viral infections, and some drugs and medications, and other include some vaccinations. And the list of infections that could cause the erythema multiforme including the following, like herpes simplex virus infection, mycoplasma pneumoniae infection, Epstein-Barr virus infection, cytomegalovirus, COVID-19, hepatitis infections, Bacillus zoster virus infection, dermatophyte like fungal infection, histoplasmosis. But among them all, these two are very important, which I have already highlighted for you guys. Okay, also we said that drugs could also cause it, like how sulfur drugs, NSAIDs, anti-epileptics. These are the three group of drugs which could cause erythema multiforme in these patients which are prone to this allergy. These are the most commonly tested drug trigger for erythema multiforme. The list of drugs include among them is a sulfonamide drug, penicillin, amoxicillin, tetracycline, erythromycin, ibuprofen, naproxen, phenytoin, carbamazepine, phenobarbital, and allopurinol. This is the whole list of drugs. If you are taking this and you are getting some of the reaction, you should talk to your physicians for alternative. This condition does have two types. The one is a minor form and the one is a major form. And what are the basic differences? We will explain it in a comparison. Like how? Erythema multiforme minor type, in which both type having skin lesions present, target lesion both have present, but oral involvement is mostly prominent in a major form. In a minor form, it may be present or maybe not. And systemic symptoms, we know that erythema multiforme is a mild condition, so systemic symptoms are very mild in a minor condition. In a major, it may be more severe. And even a patient will need some hospitalization, and erythema multiforme does not rarely need any hospitalizations. Okay, then talking about the histopathological features of this, so I will show you a very beautiful picture which will easily clarify. We will discuss it from a bottom till top. If we notice the bottom thing, this is blood vessel. Okay, these are the extravasated RBCs and some of the lymphocyte you can appreciate. That's why the outer ring you can appreciate here is redder, just because there is erythema. Okay, and then you can appreciate he's a subepithelial blister, which we were seeing that the darker zone, the middle paler zone, we say a bit blister type of thing is present. So this is basically a subepidermal blister formation. This space you can appreciate here too. Okay, this space. And also you will see that there's a vacuolar degeneration of the basal layer. The cells will also degenerate and there will be a blister type present here. Okay, then talking about the black, and of course there will be necrosis of these epithelial cells in between. So this is a very basic, very interesting. Histopath is always very interesting thing to study. Okay, let's move towards the treatment part, which everybody is waiting for. So we know the causes of this thing, mostly the infections in the drugs. You have to stop any suspected triggering factors immediately. Treat the underlying infection, especially the herpes simplex virus. We said that is the main culprit of that. An oral lesion, like you have that of gingival lesion, and that lip swelling and the lip lesions. Of course, you are going to treat it with a topical corticosteroid gel or mouth rinses, antiseptic mouthwashes like chlorhexidine, topical anesthetic gels for pain relief, and maintain oral hygiene carefully for these patients. Okay, we said that there were two types, minor and major type. Then there may be a different management for both of them. In minor cases, you have symptomatic treatment. Okay, antihistamine for itching relief. We said that the patient feel itching and pain and burning sensation. For that, you are going to give the pain relief, itching relief, topical corticosteroid, good hydration, soft if or lesion are present. Okay, this is mine. Do not need any hospitalization. But in a moderate to severe cases like erythema major form, you are going to have a systemic corticosteroid. In minor, you are going to have topical on that lesion, but in systemic, you need it because your immunity is wholly like affected. Okay, hospitalization of severe mucosal involvement and IV fluid, the patient cannot eat or drink. Like you are going to hospitalize the patient if the patient cannot be hydrated and he cannot eat or drink, or cannot be treated on the topical therapy. Then you are going to have systemic corticosteroid. Okay, then nutritional support is very important for these patients. And there is also associated condition like recurrent herpes, like associated erythema multiforme. There will be a long-term antiviral therapy for these patients like acyclovir, valcyclovir, and famciclovir. Okay, thank you so much for watching. Don't forget to subscribe my channel for upcoming videos and let me know which topic I should be covering next.